So the Thrive framework for system change really grew out of the challenges on the ground in ensuring an equitable offer and meeting the needs of very diverse populations in accessing children's and young people's mental health and wellbeing services. And as I said at the beginning, you know, I'm very much somebody who's worked within the community in you know, cross-sector contexts, and you know, the challenges in bringing a system together to think about the needs of the local population, as we know, are not new. And you know, we've got somebody here from public health, which is you know, sort of a bread and butter aspect of the work of the public health domain. And what we of course know about child and adolescent services is that there are many different ways in which needs present, and child and adolescent mental health services, which was the origin of the development of the Thrive frameworks for system change, have been, and we've seen this throughout the pandemic as well, of course, have been really pressured in terms of demand outstripping the context of service delivery as we know it currently. So that they've been very high profile and you know, national media coverage of the challenges for many children, young people and families in accessing services, which often came out of a context of needing to reach a particular threshold to be able to access services. So, you know, service delivery was very much organised around a severity and diagnostic approach to children and young people's mental health and wellbeing services. And we know that the way in which services were structured were very much organised around tiers. So, you know, thinking about the sort of primary care context of, you know, tier 1 and 2, and that actually to be able to then access a service, a referral was needed by often a specialist in the community, such as a GP or school, into specialist CAMHS services, who have been very challenged by demand and would obviously need to find a way of prioritising how they would offer their services. And often it was those who were presenting with the most severe need that would be receive a service, but often with long waits. And so there was a lot of work happening, which I'm sure you'll be very aware of over the past decade, where we've been looking at the ways in which specialist CAMHS services, so mental health services for children and young people, have been accessed. And there was a pilot payment by results piece of work that a number of sites across the country, and it may be that your locality contributed data to that as well, where there was a wealth of data from specialist CAMHS services that enabled us to really think about how services were configured and how children and young people were making use of those services. And through that work and the challenges on the ground of particularly children presenting with a very high level of need, who might be presenting in a whole range of areas. So they might be presenting in a school context, so they might be at risk of, you know, educational placement breakdown. They might be presenting in a local authority or social care context, where there might be significant challenges in a family or a home context, and you know, where they might be at risk of family placement breakdown. They might have involvement with youth justice services, and so they're presenting in many different places, and clearly a number of them having significant mental health needs. And what was a real challenge is the way in which then the young people were supported through services was to be referred to specific services. And what we know is that not everybody makes it through the door, and it means that many people don't access this help and support that is needed. So the Thrive framework sort of took that way of working and turned it on its head in many ways, looking at, well, what does the data tell us about access to services? And what became really apparent is that taking a population-based approach really enabled a different way of thinking about mental health and wellbeing services. So, you know, ensuring that we've got that investment in good prevention and promotion activities to enable the vast proportion of the population, roughly around 80% in pre-pandemic times. We know obviously that is a very different context during significant times of challenge such as the pandemic we've been through. but that roughly around, at any given point in time, around 80% of children and young people would, to all intents and purposes, be thriving. They might experience different challenges and life events throughout that their journey of as they develop and grow. That actually prevention and promotion activities can really enable them to remain well and support them in robust ways to develop their resilience and enable them to cope with the day-to-day challenges of life. And through that, having a range of activities and resources to support parents and carers obviously is key. And then what we found from the data is that the modal number of appointments that were attended by children and young people being referred to specialist services was 1. The next, so that's the most frequently attended appointments. The next most frequently attended was 2, the next 3, and so on. And so what we really understood from that was that actually, in terms of the opportunity to make a difference to children, young people and their parents and carers' lives through supporting with the offer of specialist services, there is a window of opportunity that really needs to maximise how we both provide information, maybe invest in sort of psychoeducation approaches and support self-management, whilst also having an opportunity to make sure that families, children and young people are able to make use of whatever those resources are. And so we started to think about how providing advice and signposting was a really core part of the offer that was needed to support children and young people's mental health and wellbeing needs. Now that's not new, and it certainly isn't unique to children and young people's mental health services. This is a phenomenon that we see across the lifespan. So we see it within adult mental health services as well. It's exactly the same. Where, you know, the most common attended number of appointments is 1, then 2, and so on. And it's also international. So, you know, that phenomenon is something that is at the core of service delivery, but yet we perhaps weren't acknowledging that in a way that enabled us to direct our resources to ensuring that advice, signposting and support to self-manage was a genuine and core part of the offer. So the Thrive framework really highlights the need to have good, robust signposting, self-management resources. And of course, we're seeing that over the past, you know, certainly 5 years or more within adult mental health. We're seeing the role of community navigators or connectors through the social prescribing context, which is really making a significant difference to the mental health and well-being of the adult population. Now, of course, we need to think differently about children and young people. They don't necessarily rock up in primary care and say, or and access services in the way that adults do. But you know, there's a really growing body of evidence that absolutely supports that advice and signposting offer. And there's a range of other initiatives that we know are going on at the moment. So I'm not sure within Wolverhampton whether you're currently within the family hub paradigm, but that is really very much connected with this idea of having robust advice, signposting and self-management resources available to children and people and their families. So, of course, what we also know from that core data set is that there is a significant proportion of children, young people and their parents and carers referred to specialist services that absolutely need evidence-based, good quality, evidence-based interventions which are outcomes informed, that are monitored in terms of the progress towards the goals that have been set, and through shared decision-making processes, they have opted to engage in evidence-based interventions. And that's really key for, of course, and is at the heart of the Thrive framework, which we'll come on to a little bit later, but the type of intervention that the child or young person is supported to engage with comes out of the knowledge of the evidence base and the skills of practitioners to deliver those evidence-based interventions, the quality of supervision to ensure that the intervention is absolutely aligned with in terms of model fidelity, but also ensuring that the outcomes of the child or young person are being monitored and that there are discussions about that to support shared decision making throughout the journey. And that what we know from the data is that roughly around 60% of children and young people who are presenting with mental health and wellbeing needs would benefit and actively engage in evidence-based interventions that fall within what we termed the getting help needs-based grouping. Now, there's also a proportion of that population of children and young people who benefit from evidence-based interventions, who make active decisions to engage with them, who for very varied and often complex reasons actually need a greater level of resource to enable them to achieve the outcomes of the intervention. And so these would be children and young people who perhaps have very complex neurodevelopmental needs, or might have sort of emerging personality difficulties, or we've seen again through the pandemic significant eating challenges and present, perhaps with disordered eating. And these children, young people, more often young people, but not solely, of course, because it could be young people with learning or neurodevelopmental needs as well. They absolutely benefit from these evidence-based interventions, but to be able to make the progress needed, they do need a greater level of resource to support them. And so we wanted to differentiate this group because it is about the resource allocation of services to enable the needs to be met. And that group of young people would fall within the getting more help needs-based groupings. And that might be where you have, for example, home treatment teams. So you can immediately see the different resource demand and allocation that is needed from across the system to support these children and young people who often have the need for multi-agency interventions to support them in the community. And of course, it might also include some inpatient or residential resource within that getting more help needs-based grouping. But of course, it's where there is a outcomes defined expectation around the help or support that's being offered. So then what we were also aware of is that for many varied and complex reasons, a number of children, young people, their families really struggled to engage or were not able to make use of the way in which mental health services were delivered. And so potentially might not either engage with services or choose not to, or for whatever reason, despite the delivery and offer and engagement with evidence-based interventions, do not improve. And so there are still, concerns about the impact of mental health and well-being needs on their functioning and on their symptoms or presentation. And so what we really began to think about was the need for a multi-agency approach to thinking about these children and young people to provide support around the level of risk that they might be presenting. And again, this is not just risk associated with mental health crisis presentations, it's risks associated with potential for family placement breakdown, youth justice engagement, or forensic activity, and thinking about social care requirements and so on, and often who presents with significant risk or safeguarding challenges that obviously need to have the appropriate structures and processes and procedures around them to ensure those children and young people are safe, but where the services really need to think differently about the way in which they meet these children and young people's needs. And so we developed the notion of risk support to help start to think about this population who, I'm sure all the people on this call will be very aware of, many children, young people who present almost as a bit of hot potatoes. They're sort of moved from one part of the system to another, where there's a high level of concern and a high level of worry within the practitioners who are supporting them. And so what we began to think about is how we could work differently to really build capacity in the system, support the child or young person in ways that are meaningful for them. So identifying who is their trusted individual or network within which they operate, that we could support to deliver a different type of mental health offer to best meet their needs. And so what we start to think about is how the whole system needs to come together to be able to both support children and young people to make active and informed decisions about the type of help or support they might engage with, but also how to genuinely enable shared decision making. You of course need to know what the range of offer is across all of the system to support children and young people being able to access in ways that are most meaningful to them. And, you know, it's clear, and I'm sure, you know, we've got great representation from across your local system here, and I'm sure you're starting to think of, well, what services might most align with different parts of the Thrive framework. And of course, what you would expect is that services support the needs of children and young people across a range of different needs-based groupings, and actually enabling the system to develop a shared language about the type of help and support offer, and also crucially supporting that shared decision making really challenges the way in which specialist, particularly adult mental health, specialist child and adolescent mental health services within a traditional national health context actually begin to be thought about in terms of the whole system offer. So what's provided across education, health, social care, the voluntary sector. And, you know, at the core of often the really challenging work is the relationships that different community groups, faith groups, you know, youth groups, sport contexts, you know, so I don't know, football activities or other sporting activities, and how those trusted relationships can really be developed and brought into the system to be thinking about a holistic approach to mental health and well-being. So the Thrive framework really adopts that sort of population approach, drawing together the assets from across the system to really build both a system-wide resilience, but also crucially the strength of the child, family and their local context and network to really support mental health and well-being in significantly different ways to that traditional model. So the 5 needs-based groupings are absolutely distinct, but there are often overlaps in terms of the way in which the help and support might be provided. And they're distinct in terms of the choices that the individuals have made in relation to the help or support options that they have chosen to engage with. Now, of course, we need to also have a range of skill mix across the professionals that are meeting those different needs for children and young people, and a range of resources to meet the different needs or choices of people in the different needs-based groupings. So if we just move on to the next slide. So at the core of the Thrive framework are a number of key principles that actually across the system make complete sense to anybody, you know, from a very values-based approach. And we're seeing that there are a number of different drivers. You know, the family hubs approach is one, more within a local authority context, but also thinking about you know, early help and you know, in an educational context, thinking about the role of, and we've seen it obviously throughout the pandemic, the role of education and supporting, you know, that sort of pastoral care around the mental health and well-being of pupils and ensuring that they can engage with education to support their attainment, but also a really great outcome. And even on the news today, talking about attendance and ensuring that children and young people are able to engage with you know, day-to-day activities could be, you know, part of the core outcomes for somebody just getting into an educational context again. But, you know, what's really at the core of these principles are having that shared conceptual language to really enable the whole system to understand what the type of help or support is being provided. And the Thrive framework very much focuses on a needs-led approach. And again, the national directives across all the different sectors are very much organised around this as well. So thinking about how we meet needs, not thinking about whether somebody has a particular diagnosis or has a severity of level of need, because actually what's really crucial is that the level of need, or the needs, are defined, and there's a very clear plan around the support from across the system that is shared across the system to both ensure that there's an efficient use of resources so that there's no duplication and so on, but that crucially everybody understands what is being provided across the system according to those needs-based groupings. Now, that I've mentioned a number of times about shared decision making, and obviously, for those, so well, certainly within health, we're seeing that the national sort of clinical indicators that are being, there's something called sequin indicators, where there is additional sort of there are positive gains for showing ways in which healthcare systems are ensuring that these sequins are embedded within their system. Shared decision making is absolutely at the core of the national drivers in healthcare, and so it's it's something also that's across the local authority and educational context in terms of how we support children and young people to make active and informed decisions about the type of help or support they engage in, whatever the context, but specifically in relation to mental health and well-being. And I've mentioned also about that very proactive prevention and promotion and how it's really crucial. And again, we're seeing this across a number of initiatives to really enable whole communities to support mental health and well-being. And again, throughout the pandemic, there were some really fantastic examples of this that communities naturally do. But at the same time, of course, we've also had the light shone upon some absolutely tragic inequalities in relation to access to particularly healthcare. But, we do know, obviously, of course, across the system that those inequalities are present in many different aspects of our offer. And so proactively working with the most vulnerable groups and ensuring that we build on communities' own strengths, including safety planning, are obviously crucial. And how we build capacity in the communities is really fundamental to that. So you may well have somebody who's presenting a lot of risk and concern in relation to their mental health and well-being, maybe presenting in frequent crisis, and for whatever reason is really struggling to engage with the way in which we currently deliver mental health and wellbeing services. So taking an approach whereby we build capacity in their trusted networks is fundamental to that. And there are often pockets, and I'm sure as we do the assessment tool later, you will be able to think through some scenarios where you have those pockets of really fantastic work that just naturally evolve in your communities. And what Thrive does is it really enables the learning from those contexts to be shared across the system, and really to support further development and transformation in that arena. And then just the next slide is around, obviously, to have that whole system approach, you really need to have really good partnership working with shared responsibility and accountability across the different sectors. And we know for too long that there have almost been those hierarchies, and I'm sure that you can think of them even within your system today, hierarchies of sort of respect from professionals about one part of a system versus another. And what's really difficult with that is, if we're going to support genuine shared decision making, we absolutely need to build mutual trust and respect across our different both providers but professionals, and also in terms of supporting the choices that children, young people and their parents and carers make about the type of help and support that's right for them. So it's a real challenge, and it's a move away, which is a cultural difficulty for us all, that I think any professional would say that they actively engage in shared decision making, of course, but actually how can you do that if you don't genuinely know and trust what a range of support options are available in that wider system? So that's a real core principle of the Thrive framework, to really support that cross-sector accountability, shared responsibility, and often our commissioning arrangements really struggle to enable that to happen. So, for example, within specialist child and adolescent mental health services, a real focus of commissioning outcomes has been on face-to-face contacts and making sure that those face-to-face contacts are, well, they're the sort of measure of productivity. What we know from a Thrive approach is that you also need to have ways in which you can capture the indirect contact. So supporting professionals across the system are equal, and if not a greater outcome for the system to be thinking about that capacity building. Because actually, if you're investing in the support networks around a child or young person, they may never need to go into specialist services. So they're supported and to self-manage, and through those community resources to build that resilience and manage their mental health and well-being in ways that we haven't historically been able to capture because of those processes around our activity and so on. So, having an open mind to how we can accurately reinforce partnership working through our outcomes frameworks are obviously really key. And within that, having clarity from the outset about children and young people's goals and being able to measure progress towards the goals that they set with very clear action plans and ways of managing that, a review, so that if goals are not being achieved, that there are open and transparent conversations about what else might need to be thought about to support that child or young person's well-being. And what's really core of that is another cultural challenge, certainly in relation to, professional trainings and so on. I mean, I was trained as a clinical psychologist, as I say, almost 30 years ago now. And, we obviously, a core part of my training was thinking about the evidence base. And actually what's really core is that if something wasn't working, to my training this was, if something wasn't working, then you would revisit the evidence base and think, well, what else might you try? Now, what really we need to be thinking about is that any gold standard intervention has its limitations. So we know from the sort of gold standard, randomized controlled trials that the average, or the rule of thumb, if you like, in terms of outcomes is that roughly around 30% of children and young people who engage in those really fantastic evidence-based interventions with really good quality supervision will absolutely show improvements across their symptoms and functioning, and to all intents and purposes, we'll get better, which is really fantastic, and we absolutely need that, and to be delivering these high quality evidence-based interventions. And roughly another 30% will also show improvements in perhaps their symptoms or in their functioning, so they may well get back into school, continue to develop their peer relationships and so on, but they may still have some residual needs. But again, so that 60% will absolutely show significant and measurable improvements as a result of these evidence-based interventions. But we also know that roughly around 10% will drop out or won't continue with the intervention, and we don't know, obviously, therefore, then what their outcomes are. And roughly around 30% will either not show any signs of improvement, or may indeed show signs of deterioration or a worsening of their presentation or symptoms or functioning. And so that's really, really important information, that we know that evidence-based interventions work for 60% of the population who might make use of them, but roughly around 40% won't. And so actually, what we also know from the growing body of evidence base is that if people are supported to make active and informed decisions about their care, so if they know this at the outset, and it's a challenge in mental health, of course, because you do want to instill hope that things will improve. So this is a real challenge to our training and how we support professionals to have these conversations. But we need to be explicit, and children and young people say in the participation work that we've done that, if somebody had told them that not everybody gets better, then they might have tried something else rather than trying continually banging on the door of specialist CAMs to try and get seen, and despite the long waits and so on. Because actually, if they'd have known that at the outset, they could have tried something different, and that might have made a difference. So it's also something about how we support the narrative that's there from the research studies, and enable that active and informed decision making. And what children and young people also say in relation to that is that actually it can not only be a challenge to get into specialist services, it can also be a challenge to get out. And so the, you know, children and young people have talked about how, you know, they struggled and, you know, their mental health deteriorated and they would be presenting in crisis before they potentially were seen within specialist services. But then because of the level of concern by the professionals who were supporting them, it was then really difficult for them to exit. But actually knowing what there was in the community would have helped them be able to start engaging with other types of help or support and exiting those specialist services. So, you know, that's also a really helpful and important reminder that in terms of even when specialist services are being provided, the importance of really ensuring that self-management and community resources and approaches are made use of alongside. And that can be a real challenge to therapeutic models and to you know, professionals training, which is really important to hold in mind, because in terms of the transformation journey, it can be a potential block to the way in which services could potentially work together. So, and that's something that you know, that sites across the country have shared with us about some of the challenges that they experience. So of course, a core task of the Thrive Framework for System Change is to focus on how we reduce stigma in relation to mental health and wellbeing, and really ensuring that mental health and wellbeing is everybody's business. And you know, I think it's something that has become a bit more of a cultural norm as a result of the challenges of the pandemic. And of course, we've got, you know, a very high profile activities by, you know, the Princes and you know, Catherine also supporting young children's mental health and wellbeing, and how we really engage and actively promote and support that reduction of mental stigma around mental health and wellbeing difficulties, to ensure people can find timely and meaningful support in their community. Which leads on, of course, to ensuring that advice, help and risk support is crucially, it's crucial that it's available in a timely way for children, young people and their family, wherever they are and within their community. So, you know, we know that children and young people can really struggle with going to specialist clinics or, you know, in a healthcare context. And of course, if we're going to genuinely remove stigma, we need to be thinking about the places that we might deliver the range of specialist services, particularly for children and young people, notwithstanding, of course, that we have challenges in relation to, you know, our estates and resources, but how, you know, we build into the work across the system things like, you know, how the Thrive framework can support, I don't know, transport strategies, you know, enabling people to access a range of resources, but they're not potentially, I don't know, being on a bus route, or you know, you can only access them by car, or you know, is obviously a clear challenge. And so in diverse geographies, we need to be thinking about how and where we might base our resources to support that. And I'm sure that's something that's at the core of a lot of your planning. You know, that's not new, but you know, really important to think about, you know, what sectors are not represented in this meeting and training today, that, you know, you might be able to support in your role to enable that wider transformation of services, to ensure these principles are thought about in other aspects of you know, public service delivery. Okay, so we've just got an animation that we co-produced with children and different strands of the Thrive framework, but said through the lens of what the Thrive framework means for children, young people and their parents and carers.
Most children and young people thrive emotionally, even with the ups and downs of life, with the support of their parents and carers, their brothers, sisters and friends, and other important adults in their lives. We don't just want to wait until things go wrong to help them thrive. If everyone works together, we can take steps to encourage good emotional health. Some of these can be small things, and others, big things. But even if we all work to provide and promote good, active, emotional well-being, some children and young people develop additional emotional needs. There are times when it can be helpful for a trusted person to give useful advice about what might help, or give advice and signposting to know what the options are. Occasionally, young people don't want help, but the adults around them, or their siblings or friends, are worried. And when this happens, all the people need to work together to keep children and young people safe. And if we can help them keep safe and build trust, it might also be useful for some to get more help. For some children and young people, we know lots of help will be needed from across the community, and that others will need less. There are many things that are known to be effective in helping us feel okay, so that we can cope better with the ups and downs. Getting the support needed starts with someone noticing and listening, being interested in others. If we work together, these conversations are the first steps in understanding a child or young person's emotional needs, and to think with them about choosing the right advice, help, or support to meet their needs. Sometimes talking and really trying hard to see things from their point of view might even be enough on its own to help someone get back to thriving. So let's work together to ensure that children, young people, and their families' emotional health and well-being is everyone's business, and help them to thrive.